Hey everybody, it's Chris over at Dixieland Farm, and today I am doing a total knee replacement diary entry. This is my 12-month post-op total knee replacement video. Truth be told, it's actually closer to 14 months. But I wanted to give an update for anybody who has been following along or who has done any internet searches and happened to stumble upon my videos. If you haven't seen my videos and you are interested in the total knee replacement process, you may be going through it yourself or considering it, there's a playlist on my channel for total knee replacement diary. You can see the pre-op, the pain I was going through, the medications I was on, my story, and then the actual operation itself, and then the most important, probably the part you're interested in, is the recovery process and all that entailed. If it wasn't for this diary series and me going back and watching, if you asked me, Chris, how much pain were you in after the operation, I would have been like, not much. Having this video series and me going back and watching, now I have forgotten how much pain I was in pre-surgery and post-surgery, because time lessens pain. That's just a fact. Ask anybody who's ever had a child. From what I understand, it just kind of fades. So, what is the pain level I'm at today, a year later? Anybody watching this, I'm sure, is interested in that, and it is great. I am not in no pain. Right? I have some pain, but nowhere near what I had pre-surgery. So to catch anybody up who happens to stumble upon this video, I've had 3 knee surgeries before, arthroscopic, and there was very little left to do other than the total knee replacement. The MRI didn't show nearly the damage that I had, nor did it show the deformed bone that I had, which was causing my problem. Basically, the top of the, was it femur, right? One side was longer than the other and was pounding all the weight on one side. So basically that whole side of the knee was destroyed. The doctor said it was roughly like chewing gum, the meniscus, the cartilage. So it was barely there, and none of that showed up on the MRIs, nor the 3 surgeries prior. So we went with my pain and talking to determine that knee replacement was the best option. Other doctors refuted that based solely on the x-rays and not even the MRIs. They wouldn't even send me for MRIs, even though I already had 3 surgeries and they had already seen how bad the meniscus was from past pictures. So, also a lesson, trust your body, not just science, Yes. So the pain level that I'm in today is roughly, I sort of need to take an aspirin, but I don't actually take it. So on a scale of 1 to 10, 1. I notice it. Compared to the other knee, I notice, hey, this one aches a little bit. Having a total knee replacement at middle age, I am now 44, will be 45 soon. So I had it when I was 43. Is unusual. Normally this happens in mid-60s, sometimes in the 50s, but usually mid-60s is when you get a knee replacement. I did have a comment about the technique that was used, and I'll get into that in a second. But let's go ahead and take a look at my knee. I will say this, I've had surgeries in the past, shoulder surgery, I had an elbow surgery, and you can't see it now, but I had a scar for many years until it finally disappeared. So I don't think people's keloid would be nearly as bad as it is on me. I think I just take a long time to get rid of my scars. Chicks dig them though, so it doesn't matter. So there is the knee. I'm going to try to show you. And on tippy toes here, you can see that the operated knee is different than the actual regular untouched knee. It is puffy still. It is no longer warm to the touch, but this size is normal and will stay like this for the rest of my life. One thing they didn't tell me prior to surgery is that by cutting down here, this area is now numb. The window will shrink, but this will always remain numb. And the only reason why I'm bringing that up is somebody asked me about kneeling. And while I can kneel, I don't like to kneel. And it just feels wrong because of the numbness. So being on my knees just feels wrong. I do everything I can to kind of avoid that. I usually will kneel on my good knee and kind of keep my other leg either straight out or up or something like that, though I can do it. Pain level before, just in case you haven't watched my other videos, I would wake up in the morning and about 5 to 10 minutes after being up and walking, I would be basically shot the rest of the day and I'd have to sit down. Pain level now, I can work on the farm for about 2 to 3 hours before I have to sit down for 5 or 10 minutes, and then I'm good again. Then I can get back up and work. If I've worked all day and I'm on my feet all day, especially on uneven grounds, I will feel it at the end of the day. I almost have to take a Tylenol or something like that, but I don't always. So, was the operation a success? Absolutely. Absolutely. I can't imagine my life would have been like if I kept on with that level of pain. So this level is more than manageable. It's a success. The doctor said I'm 95% healed. So this is basically what I've got for the rest of my life. This pain level, everything. And that is fine. I'm fine with that, because prior to surgery, I would have, if the only option was amputation, I would have taken that as an option. So I didn't have to be amputated. I get to walk on 2 legs. What a success. Now, somebody had mentioned about the technique. This technique is a traditional knee replacement. There are some newer techniques now. They did use the Mako computer-assisted robotic arm for surgery. However, there are some new techniques, one with kind of a crimping, one uses a laser 3D printing, I should say. And somebody called my doctor a butcher in the comments. Everyone else has been just lovely and very supportive, but this one guy was a little brusque in his delivery. And I'm now talking to this guy. I don't think he's watching the video, but I will at least address what he brought up rudely. And I refuse to bring it up in the comments and refute it and get into a war with him. But I will mention it to anybody who's watching it, who's interested in maybe why did I take the more traditional technique over the newer and upcoming technologies. And the reason is track record. So I'm a man in my 40s. We know that I will need to have a revision at some point. A revision is just fancy dressing up of the word is they're going to have to just redo the whole thing again. And we know with the traditional technique, I should get anywhere between 10 and 20 years out of that knee. So we will just split the difference and say 15 to 20 years. 15 years on the knee before they have to go in and do it again. Knowing what my rough lifespan should be, that means I should be able to have another 2 revisions before I go ahead and meet my maker. That is important. The newer techniques do not have nearly the same track record and statistics behind them. We don't know how long they'll last. Matter of fact, the 3D printing knee replacement has already had a recall. So the same thing with the crimping technique. While that should be good, there's just not enough data. So we erred on the side of caution and expectancy before I have to go through all this again. That's why we chose the more traditional technique while there are new techniques out there. So, to the one person who made that comment who might be watching, not everyone is in the same situation as you. And we'll just leave it at that. So, everybody, thank you so much for watching. Thank you for indulging me. Thank you for all your kind comments. I didn't really expect to reach as many people who were contemplating knee replacements, which was such a benefit. I just wanted to document it for myself, my family, and friends. And there actually weren't enough videos, I did notice, but that's not why I did it. And I'm so glad that people have found my videos on this topic and it has helped them make informed decisions. However, this was just on me, my situation, my life, my doctor, what I had going on. Everybody is different. This is not a reference guide, I guess is what I'm kind of getting at. So, always talk to your doctor. I know several people have been very concerned about the levels of pain afterwards. And, within a week or 2, I was really not on too much pain medicine anymore, especially during rehab. because I needed to drive myself to rehab, and I did. I drove myself to rehab, which means I could only take Tylenol. So everybody's pain level is different also. I really don't know if I'm kind of, strong or weak when it comes to pain, to be honest with you. But the reason why people are concerned is because of the opioid crisis. Listen, you're going to be seeing your doctors so often and going to rehab that even if you could only get 3 days of prescriptions, you'd be seeing a doctor every 3 days if that's what it took. So don't let the medicine and all that's going on with that be the factor that scares you away. Even if you had to stay in the hospital for a week to get the knee replacement done, I would still recommend it. So that's just from a couple of people who have questioned me about, could you live without being on an opioid? Short answer is no, but people are not expecting you not to have medicine and pain management. As a matter of fact, you're basically sent to a pain management specialist immediately. So don't worry about that. Everybody, again, thank you so much for watching. If you have any questions, always leave it down below. This is probably the last entry of the video diary, since this is pretty much my knee, unless I have an issue. Let's hope not. So, take care.